You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, cosmetic dentures. Now dentures can look more real, more authentic, and more comfortable than ever. With us, we have an expert on the topic, Dr. Angeli Kapoor. Dr. Kapoor, welcome to the program.
Hi, thank you.
So affordable dentures.
Yes.
That look real, that look cosmetic.
Yes.
Now for people, by the way, and you're just tuning in, the second half of the show, because you're a husband and wife dental team. Where are you guys located?
We're in Irvine.
Irvine.
Yes.
And you both work together?
Yes, we
Every
do.
day?
Not every day.
Not every
but
day?
we have the same practice together.
Okay,
Yes.
good. So for people that don't know your practice, tell me a little bit about what you do, what your role in the practice is, who's your typical patient, and what your husband does.
Well, I do general dentistry. I do everything, and I do anywhere from filling to a crown, root canals, veneers, dentures, and implants. Basically everything. And we see all types of patients, from a 3-year-old kid to a 30-year-old and 40-year-olds up to 80-year-old.
Where are you located?
In Irvine.
Where about?
The heart of Irvine, basically right in the middle, Culver and Branca.
Okay.
Yes.
And how long have you been there?
I've been there for 4 years.
The show, we've divided this. We're going to have your husband on the second half talking about dental implants to secure these dentures, right? But
Right.
we want to talk to you about the dentures. Have you done a lot of dentures? I mean,
I
are there a
have.
lot of people wearing dentures? Because
There's-
this show will hit at least 25 million people.
Yes, there's a lot. There's hundreds, thousands of people wearing dentures, upper, lower dentures, partial dentures. A lot of people you wouldn't even think are wearing dentures. Yes.
Okay, and you say, now we've talked on the phone, you say that the newer dentures, the gums look authentic, the teeth can look real, they can even be made of porcelain. Elaborate on that.
Yes, you have many options, and when I make a denture, I really look at all of your features. I look at the side profile, the front profile. I really try to make it look as natural as possible. I look at how the lip falls on the denture, the length of the teeth, the length from the nose to the chin. So everything combined tends to make the denture look very natural. And you do have options from acrylic teeth to porcelain teeth if you want them to look nice and shiny and bright and white. And basically also it supports the facial structure, so the skin and the muscles.
Because it seems like denture get that sunken
Yes,
upper.
they do when it's not fitting properly.
So when you give them a new denture, what? It builds out.
Yes, it supports the face, it supports the skin, the muscles, and it gives almost like an instant facelift and smooths out the
Okay.
wrinkles. And patients tend to look 10 to 20 years younger,
Is
I would
that
say.
right?
Yes, definitely. When the patient takes the denture out of the mouth, all of a sudden they look 30 years older. They put the denture in, and it's totally different.
Are there a lot of people in the world, and for people just tuning in, I mean, you do more than dentures, but we invite you on
Yes.
the show to talk about dentures.
Yes.
But are there a lot of people that have dentures that just hate their denture?
Yes.
And that you could make it look and fit better?
Yes, definitely. Patients have come in complaining how they've had it for so long and it's kind of just floating in their mouth. And we make a new pair of dentures, and some people like that, but then some people really want a better fit, a more sturdy fit, and that we would give an option for implant-supported dentures. So there's many options, and some people want to wait till they can save up for that, maybe. And
To get dental implants
yes.
to secure
secure
those.
the denture, yes. So it's in there snug.
But with the gums on the dentures, I feel like that's the dead giveaway.
No, actually there's a range of shades, a range of colors that the patient and I can help pick. And also we can also have the lab technician come into the office and actually look at the skin of the patient, and match everything to the patient and how they look and make it look very natural. So no, and I've seen patients that walk out the door, you can't even tell they're wearing dentures.
You say young people have dentures.
Yes.
Like how young?
I mean, I've seen up to 30-year-olds have dentures where they've had their teeth taken out at age 20
Okay.
due to trauma or an accident or congenitally missing teeth. So it can be anybody. And a good thing we have this, that we can give them a set of teeth so they can chew and be presentable in society and enjoy their life.
Now these denture wearers, you say they hate their dentures, they have old looking dentures and they're afraid to come in. Is it the money? Is it they just don't like going to the dentist? What is it? What's your take?
I think they don't know their options. Maybe they think that, you know, they're not going to get anything better than that. But the truth is they can, and it can easily be done, and they can be a part of the process. So they can tell me, you know, I want it to look like this, I want these kind of teeth, I want, you know, this shade, and I really work with the patient to get that done.
Do you still have people tell you, and you know, because people hate going to the dentist, right? Do you ever have people tell you, no offense, but I don't like going to the dentist?
All the time.
They tell you that?
All the time. They'll tell me to my face,
Like,
I hate dentists. And I'm like, well, you hate me? No, I don't hate you. So, you know, they always say that. And then we just get past that, and I start to ask them what they hate about it, and I try to help them out with whatever they don't like.
I asked you on the phone, I said, I wanted you to brag about yourself. I go, do you think you do anything that is better? And I'm going to paraphrase, but you said that you think you have an ability to put people at ease.
Yes.
You think so?
I think so, because I've had many patients that come to me and they start talking about their nightmares and how they're so scared and so many things, bad experiences. And I just talk to them. I give them breathing techniques. I calm them down. I tell them I understand. And I don't know, maybe it's my voice, I'm not sure what it is, but...
Well, you know, females, it seems like we want to go to a female dentist. Are there a lot of female dentists?
I think there is more than male dentists, at least in dental school.
Is that right?
Yes.
So, you know, I didn't know that. So do you think you have an advantage? I mean, do people want to deal with you over your husband because you both work in the same office?
No, actually, he's very gentle. He is. He works on me, so I know. He's gentle,
right?
yes.
What have you had done? Are those dentures?
No, they're not.
It's your own teeth.
Yes.
Now, they're affordable. And, you know, the main thing is, and we hear about people going to Mexico for their dentures.
Yes.
What do you have to say about that?
You know, I don't recommend that. I've seen dentures that are made in other countries, and they're not to our standards.
Well, you can tell us the truth here, because they're not going to come get us, by the way. I mean, you don't like the Mexican dentures.
I don't.
Okay.
And
not really that much more. I mean, I know the difference in prices.
It's really not. It's not a big difference.
Nothing.
And we can work with the patient. There are options, payment options. And it's a daily thing. You're going to be wearing it every day. So it should fit right.
And
it should look
the doctor
right.
Here. That's a good point.
Yes, and if there's any kind of adjustment needed, the doctor should be available. You should be able to contact your doctor and be close to your doctor.
Okay, now we should admit this too, because I want to make sure, because you wanted to get this across, is that at your office, it's not just about dentures.
No.
The next level up is your husband.
Yes.
Who does dental implant surgery.
Yes.
Right? Places implants, like 2 implants, get a fixed set of teeth that locks in, or 4 that don't even come in and out.
Yes, that's ideal, that you can have a set of teeth that are locked in place with 2, 4 to 6 implants that gives you a permanent set of teeth, which you can chew with and basically just clean them, and they're like your natural teeth.
Now, in the practice, your husband does the dental implants, right?
Yes.
But do you believe that it's a better option than dentures?
I believe it is, yes. And if it were a family member, I would definitely recommend implants.
Dental implants?
Yes.
So with 2 implants, you say with 2 implants, and I'm going to talk to your husband next, by the way, about this, but with 2 implants, you can get, that means no more adhesive, a snap-in, you could use your own denture.
Yes.
Is that true?
Yes, you can. If you have a denture and it's fine, it's not chipped, it's not worn down, and you want to have it permanently, you know, snap in, you can just have the implants done, and we can reline the denture that you already have, and you can use that denture.
Okay.
So
now, what about the people out there that are watching this? Because I know, look, you know, I invite you to talk about dentures because that's what we had available, you know, what we wanted. But what about the people that don't know? Maybe they need extractions or their mouth's a mess. Do you handle that?
Yes, I've had patients come in and they haven't been in for, you know, 10, 20 years, and they just, teeth are hurting, they think it's a mess, they think they need dentures, and they think they need all their teeth pulled out. But that's not the case. A lot of times it's not the case. They may just need, you know, a couple crowns, a few fillings, a really good cleaning, and maybe a partial denture, or maybe not even a partial denture. So you really have to come in for your exams and your checkups and really see what's going on.
Do you think you have an advantage? Because there are certain companies, I've done the research, and I'm not trying to endorse you. People need to know this is a real interview here. But there are certain companies that all they do are dental implants, right?
Yes.
They don't do dentures.
Yes.
So why go to you? I know you guys do both, but is there advantage the fact that you do dentures and dental implants?
Yes, I mean, the advantage is that we look at the whole mouth, we give options. You know, some people are not ready to have all their teeth pulled out and have implants and dentures done. Maybe they want a transitional period with just a partial denture or just a denture and then eventually get implants. So we have many options. It's not just one solution. There's many options.
So we're going to bring your husband on, and we're talking about dental implants. No more dentures, he says.
Yes.
Get a fixed set of teeth with like 4 or 6 implants. What can you tell us about him for people? And he's not in the studio. He can't hear what we're talking about.
No,
So
he's
about him.
great.
What can you say about him?
He's great. He's very personable. He's gentle, and he's very understanding. He can tell where the patient's coming from, and he tends to calm the patient down as well. He's very good.
Now, dentists seem so serious. You guys have fun at the office?
We do. We joke around all the time.
You do?
Yes.
Okay, good. I
Yes.
want to thank you for coming on the show.
Thank
Very
you.
interesting. Pleasure.
Thank
you.
you.
Because, you know, we couldn't get you on the show before.
Yes.
So we had to talk you into it. So thanks.
Yes. Thank you.
All right. You've been watching the Wellness Hour. Up next, no more dentures. Get a fixed set of teeth in just a few appointments with a few dental implants. We'll be right back. You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures, according to my first guest. He says with 2, 4, 6 dental implants, you can get a fixed set of teeth in your mouth that don't come out. You can eat and you can chew. It's changing dentistry altogether, according to him. With us, we have Dr. Joshi. Dr. Joshi, welcome to the program.
Well, thank you, Randy, for having me out here.
Now, we've had you on the program before.
Yes.
It was a pleasure meeting your wife and talking to your wife about cosmetic dentures.
Right.
For people that don't know you, your practice, who's the typical patient? What are the different procedures that you do?
Sure, Randy. You know, typically we have patients that range from the age of 2 all the way up to in their 90s, because there's no such thing as a typical patient in a general dental practice,
Right.
and that's what we cater to. We cater to everybody, and we pretty much do every single thing that's being out there, a service that's being out there for dentistry, and in the sense that we actually do, you know, your simple cleanings, exams, fillings, crowns, to going towards veneers, prepless veneers, lumineers, snap-on smiles, and going to more advanced stuff such as all-on-4, you know, dental implant-supported teeth, to, you know, more such things as, you know, full mouth rehabilitation and supporting implants for missing teeth, which unfortunately some people have lost over the years.
So let's begin then with the categories of dental implant patients that you see.
Sure, Randy. So we have people that, you know, will be in the first category, which is missing a single tooth. So you could do a dental implant to replace a single tooth, or you could do conventional dentistry of doing such thing as a bridge, where we replace, you know, the missing tooth by shaving 2 adjacent teeth. But the dental implant is the greatest thing because you just put one dental implant, it's done. It's a done deal. They never have to worry about it because.
So ideally, a dental implant, even for missing one tooth, is better.
Oh yes, because it's a lot more conservative and it has a lot better prognosis.
Meaning it's going to last.
Of course, it's going to last, and it's not going to involve its neighbors, so you don't have to worry about dental issues on the other teeth that much.
So the next level up is what?
So the next level up is people missing their back teeth. So sometimes some people are missing like 2 or 3 teeth. Now, why should they even take care of this, Randy? One of the biggest reasons why you want to take care of this is if you have missing teeth on one side, you're going to start chewing on the other side. As you start chewing on the other side, it's going to compensate for the missing teeth on one side.
Okay.
And you're gonna end up actually having a lopsided bite, and that's going to cause multiple issues. You're going to start, you know, fracturing teeth that you naturally have. They're overcompensating for missing teeth. So having said that, what you want to do is you just want to replace these missing teeth with dental implants. And sometimes
Sounds painful.
No, you know, it's virtually painless. And when I say no, because I've seen so many results that I could just tell you that they're afraid of pain going into it, and we take care of that by making sure they're comfortable going through the procedure, and afterwards there's minimal pain because we give them proper medications and they are looked after properly to make sure they have good results. And you know, because there is no nerves in the bone. I'm sure you might have 1 or 2 nerves, but that's properly planned when you do your CT scan before you go into having the procedure done. Remember, planning is everything before you do this.
So moving on to dentures.
Yeah.
You say no more dentures. How big of a problem is it? I mean, this show will hit 22 million, 24 million people in LA, Orange County.
Randy, it will surprise anybody when I were to tell this number. It will affect at least a couple million people.
Okay.
At least a couple
with an
million
upper lower
people.
denture.
Yes, with an upper lower. And they don't have to be with these ill-fitting dentures and suffer every day of their lives.
Okay.
You can actually put a couple implants and get them going at least with a stable set of dentures, so they could chew, and sometimes they could even chew an apple.
Is that right? So that's the beginning. 2 dental implants where? I think you said.
Yeah, 2 dental implants on the bottom, and we position it in a proper place. We do all the workup, and we just put these 2 little pins, dental implants, and it doesn't hurt because remember, the bone does not have nerves unless you're talking about the major nerve, but that's already planned for before we go into the
So
procedure.
you avoid that nerve, obviously.
Totally, yeah.
Okay. So, and you can get a full arch of teeth with 2 dental implants?
Yes, yeah, full arch of teeth, and that denture fits in there properly and doesn't move. So can you imagine like going on dates and stuff like that and talking with a denture that's moving and you can't even chew properly? So that's what these people have to worry about. And so we give them hope by we give them 2 dental implants for the bottom denture.
But if it's so
and make it work.
good, millions of people wearing an upper lower denture, over a million, in Orange County, LA County, why aren't they all doing it?
Well, they never go back to the dentist. They've already gone through so much pain and suffering by losing 1 tooth at a time or maybe multiple teeth, and they ended up with that denture. Then they're like, well, I'm done with this. I'll never have any teeth issues to worry about. So they never go back to the dentist, so they're never
Just for a
offered that.
reline, I guess, to fix the...
Maybe just for a reline. And when they go back to the reline position with that dentist, sometimes, they never bring out the discussion where I wish I could change something. I wish I could be better off. They never bring that discussion out. They need to bring that discussion.
What's another reason why?
Well, the other reason is they're afraid that it's going to be costing exorbitant amount of money to replace all their missing teeth, so they need to have a dental implant for each area of missing teeth. And I could tell them it's far further from the truth. Look, it would be great if I could replace each missing tooth with single dental implant, which I've done.
But
for
you
some
say just
patients.
2 implants, give them a full arch of teeth, snap in, snap out.
Snap in, snap out. Exactly.
What about if they're too old? I mean, even my mother said this. 74 years old, her medical doctor, this was quite some time ago, she said, 74 years old, her medical doctor said she's too old. But you say that's not true.
Well, that's a medical doctor saying that. And one of the things about that is the times have changed, and we have all realized that this has become a very predictable procedure for people even in their hundreds. I have colleagues, and I have super specialists that I talk to on a daily basis. They're doing dental implants on people who are in their 90s and hundreds.
Why would a 90-year-old want to do this, though?
Randy, they want to be better off. Right?
Okay.
Right? You want to be better off.
They want to eat.
Yeah, they want to eat.
And they don't fall out? They're not more likely to fall out than a 90-year-old?
No. The science shows us one thing. If you do it right and you do it in a nice way where you plan everything, it's going to work.
Okay,
and
good.
it's already shown us so many results, countless results, that it's worked.
Okay, you brought models. What are we looking at over there?
Sure. Yes. All right. So I brought some models. All right. So let me just show you this. Okay.
Okay.
This is 2 dental implants right here, and it's taking me.
Are you exaggerating a little bit?
No, I'm not.
Dr. Joshi? Okay, let's take a look.
2 dental implants, and I'm just, it took me a couple seconds
Let me
just to
see
take this
Let me
thing
see
out.
this. Okay.
There you go.
So this is like a lower,
A lower
right
denture.
here.
Right.
and these are, and then
Yeah.
I don't know if the camera could see this, little snaps.
It's
underneath
called
here.
That's right. It's called a snap-on denture, and that's for the bottom jaw. Okay?
Okay.
Now for the top jaw, or we call it the maxilla, what you want to do is you want to deal with 4 dental implants. You can't just do 2 because you're in a position where you need to uphold it because gravity is pulling it down, right?
Okay.
So you want to put 4 dental implants in there. Nowadays, Nobel, which is one of the leading companies, they figured out how to do all-on-4 implants, which will give you a fixed set of teeth by just putting in 4 dental implants. That's it. Let me tell you what denture wearers hate on the upper arch.
Okay.
They hate that roof of the mouth being covered up by that acrylic. You can't even enunciate certain things. I mean, they hate it because like food gets stuck up there, and it's a weird feeling, and it smells nasty too after over time. They don't like it. And if you,
So what's the answer?
So the answer is just get an all-on-4 dental implant procedure done. That's it.
On the upper, like a full arch of teeth.
Full arch of teeth. That's it. You're done. You put 4 dental implants. Now, if you want to get, if you want to get really fancy, you want to have perfect teeth, then you might want to put 6 dental implants, 8 dental implants. The more dental implants, the more we could get you individualized crowns replaced by, the dental implants.
Now, I'm not trying to endorse you here. People need to know it's a real interview.
Yeah, yeah.
But the way it's normally done, and please correct me if I'm wrong, you go to one person that's a surgeon that does this, puts in the implants.
Yes.
Then you go to another doctor that puts the tooth on top, or even the whole arch of teeth, the snap-on denture on top.
Right.
At your office, you do both.
I do both.
Is that right?
I do both.
Is there an advantage to the patient other than convenience?
Well, it's about seeing the future. It's about seeing the roadmap. See, when the surgeon places in the implants, the surgeon must be able to see what the outcome is going to be.
Meaning what the teeth are going to look like
What
on
the
those
teeth,
implants?
exactly, what's going to be on top of those dental implants. So you must be able to envision that, and then get to that point.
Is it less by going to one guy, you think?
It could be, yes. And I really think it is. It is. Now, at sometimes, Randy, I might have to go to my super specialist and we might back each other up and we get this to be done properly.
Okay.
But guess what? Either ways, we both see the vision.
Now you say, and we're out of time, but you're changing people's lives,
Yeah.
especially the denture wear.
Yeah.
Elaborate.
Sure. I mean, I could give you stories. I could bring up pictures and stuff, and I could bore everybody to death right now by going through each individual person. But let me just tell you the overall feeling that I get from my patients.
Mm-hmm.
The overall feeling is I give them a set of teeth that work. And what does that do? That allows them to eat. That allows them to laugh. Laughing is one of the most important human emotions. I mean, I laugh when I'm out and exhibiting happiness. So happiness is what I give them. And also a set of teeth so they could chew and eat. That's what these teeth are for. And happiness.
So are there denture wearers that complain they can't laugh out loud because they're worried their teeth are going to come out? Is that what you're saying?
Yeah.
Okay.
Yeah. They're afraid because guess what? When they smile and when they're trying to laugh, sometimes the ill-fitting denture pops down. Because
Okay.
when they move their muscles in a certain way, the ill-fitting denture is going to move as well. They're afraid of that. So they put all this goopy stuff, try to make it work. Sometimes it works. And sometimes it works only to a limited capability. So when they're out chewing in a restaurant on a date, it's going to pop out.
Okay.
And that's a horrible feeling. I wouldn't want to have that.
So ideally, and we're out of time, but for people that missed the top of the show, your wife within the practice, I mean, you guys do all types of dentistry. She does cosmetic dentistry, she does kind of full mouth, rehabilitation, but you also do cosmetic dentures.
Yes.
So she's doing cosmetic dentures. Is it mostly for people that just can't afford it or aren't ready for dental implants?
Yeah, I mean, let me just go just a tad bit on segue. For someone, for example, someone who has dental cancer, or oral cancer, I should say.
Okay.
When they have oral cancer, they lost their teeth, you might not be able to put a set of dental implants right at that same moment.
Okay.
You might want to buy some time, by a year or two, by having dentures.
Okay.
She could get that right, and I can help her support it with dental implants when the time is right to put the dental implant supported denture.
Okay.
And that way, we can restore that person's self-confidence of their teeth that they lost and give them the ability to live their life, which is amazing.
So you think the future of dentures wearers are all going to have implants in their mouth to
Oh, yeah.
give them a snug fit?
Yeah, yeah. I mean,
And you could be 70, 80. I mean, 70 is young today. But,
Oh,
I mean, you
yes.
could be 80 and get this done?
70 is totally young. I mean, 80s. I mean,
What's
you
the
could,
downtime, though? How soon? Okay, so in a perfect world, let's say they're a healthy 80-year-old, right?
Right.
80-year-old comes in, if everything works out right, and they want a fixed set of teeth, what's the turnaround time? How soon can they eat?
Oh, they can start eating that night. Why
Really?
couldn't they? Right? So the way to do it is they're going to have liquid diets the first day, right? Second day, they're going to have semi-soft foods for the next couple days. We give proper medications to make sure they're okay.
Mm-hmm.
And follow it in 3-4 days, they can start eating more solid foods. And sometimes, if everything is done properly and if they adapt really well, they could even bite onto an apple that same
So
day.
within a month, somebody watching this, they're a denture wearer. Within a
Yeah.
month, they could be eating broccoli,
Oh, yes,
like
of course.
a carrot. I'm
Oh,
talking
yeah,
about for
yeah.
the fixed set of teeth with enough dental implants. They
Yes.
could eat a carrot. So it doesn't matter. I mean, they could eat like regular teeth.
They can eat like regular teeth. And they could eat that nutritious stuff, like you mentioned, carrot, broccoli, which is what's needed for the rest of your body, not the processed foods, because they couldn't eat that because of the poor, ill-fitting dentures.
Is this the happiest group of patients of all dentistry, by any chance?
You know, I like working with a lot of my denture patients because they start gaining respect and value back to getting their teeth back. And they're really grateful, and they're really fun to work with, because the fact is, for them, everything that we do is going to make it better. That's it. That's it.
I want to thank you for coming to the show.
Yeah.
Always a pleasure, and thanks
Of course,
for
Randy.
having your wife on the show. You guys are the dental implant team.
Thank you.
The go-to dentist in and where are you located, by the way? You're
In Irvine.
Orange?
In Irvine. Yeah, yeah.
Where about in Irvine?
We're right on Culver and Barranca, right in the middle of Irvine. And you know, I picked this location because it's central Orange County, and I know there are millions of other doctors that are out there, but one of the reasons why I like this location is I really like to get everybody in Orange County who really needs help to at least get them their options and start moving forward. Let's get steps going. And we have amazing third-party financing and all that kind of stuff to take care of their challenges that they need.
Okay, good. Well, thanks for coming to the show.
Of course.
Pleasure. You're
you.
watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can go to our website, put in Dr. Joshi, you'll find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.